So in office, our therapies on the table are going to be for muscle therapy. We love to do a lot of pin and stretch at the rotator cuff muscle. So if we identify what the directional preference is, it's usually really nice to take that shoulder into that repeated movement and do a pin and release and get a lot more blood flow and neurological set onto the muscle and onto the tendon. Also, just trigger point release in general. So if we need to get in there and bust up adhesions and knots and tacking down spots into the muscle, then getting in there and really hitting that is a very beneficial thing to do. And of course, with us being chiropractors, we love our manipulation therapy. As I've maybe said in other videos, I'm really cautious about how aggressive we manipulate the shoulder. I generally find, and we generally find, that a good mobilizing or overpressure stretch is just as beneficial as getting in there and adjusting, since there's so many degrees of flexibility and mobility at the shoulder. So once again, to adjust the shoulder, we would pretty much help the patient go further into their directional preference, whether that's internal rotation behind the back, external rotation, extension, you name it. The protocol, the assessment is going to guide the treatment from there. And then it's usually good to do some sort of cervical spine work, whether it's tractioning or mobilizing. If the patient's on board with the manipulation and we've safely ruled out vertebrovascular arterial concerns, then we would certainly be happy to do that. And upper thoracic, especially anything T7 to about T1, is really going to help out at that shoulder. As we've probably alluded to before, there's a really tightly knit function between the cervical spine, thoracic spine, and the shoulder. Often just working into one of those areas is going to indirectly benefit the other two areas. So that's why we like to take those along and work with those with our chiropractic manipulation therapy as well too.